Hi, this is Dr. Nick. I'm the Incrementalist here with incremental insights for better business, better health.
And I'm Fred Golsey with Accountable Health, here working with employers to help their employees improve their health and look at their overall employee health benefits programs. So, one of the areas, Nick, that's been interesting has been this idea of get everybody their 2 shots as quickly as possible or kind of spread them out, which I believe was the UK strategy around this. So, I understand there's a preprint article out discussing that. What's that show?
Yeah, so just to be clear, UK strategy, UK guessing strategy a little bit. There wasn't a tremendous amount of scientific data to support it, but actually it won out. It proved to be very effective. I think the UK has done a good job, thankfully. But you're right. One of the things that we've really struggled with in this pandemic is, okay, so you get vaccinated. We know it protects you. We know it's not 100%. We've discussed all of those issues. And yes, you can be vaccinated and still get the disease, but it prevents you from getting severe disease and, from dying from the disease, and has all sorts of, additional side benefits. But the critical piece here is, does it prevent the transmission of the disease to other people? And thankfully, the UK has done a good study. It's pre-published, so it's not been peer-reviewed, but it was reviewed in Nature. And essentially, they demonstrated a very clear reduction in households. So a great way of assessing this, you looked at people that got infected where they had a spread of vaccination, maybe some individuals that were vaccinated and not, depending on age and so forth. And they demonstrated that it reduced the spread of the disease by at least 50% after one dose of a 2-dose regimen. So that means intuitively, not based on science, but sort of thinking about the science and how these things work and the elevation, the booster dose, that if you had 2 doses, that number might actually rise. But 50% is great news. So good news, you get vaccinated, you're less likely to spread the disease. And if you wanted another data point to suggest why that might be the case, or supporting evidence, just look at Israel. The signals in the Israeli data where they went after this, did a solid job of getting through the population, and you saw this really big steep decline. That couldn't just have been about preventing the disease in the first instance. It had to include some of this. So now we've got some good data on it.
Fascinating. So, I know in the United States, actually, it's interesting because there have been a whole ton of folks that apparently haven't gotten their second shot. So, maybe a little better impact for us here, although it would be great to get that second one in.
Yeah, let's be clear. There's the science and the studies that were carried out showed this, basically incredible positive impact of this second dose, with the exception of the Johnson and Johnson Janssen vaccine, which was designed as a single dose and performs equally well based on their data. But if you're in a 2-dose regime, you should make sure you get that second dose, because it's just going to give you additional benefit.
Mm-hmm.
And before we move on from that, why are people going not or not going for that? You've seen a little bit of that, Fred, right? I mean, the response is, well, I don't want to get sick, and I'm hearing all of this. People get really unwell. Well, have you had your second dose yet?
I certainly did. I
And
certainly did. And I was one of the ones, actually, because I've been reading about this, I was one of the ones that had no impact. Nothing.
well, you're not one
You
of
know?
the ones. We're
No.
both.
Yeah,
There's an N
which
of
has
two,
been
right?
interesting, and they're now doing some studies on why this is that some people have a much more severe symptoms from the second shot versus or from the first, as well as or have none. And they've said clearly the immune response is still there. It's just different, and in terms of how your body's impacted by those shots. So I feel pretty good. I've gotten the 2 in. I would hope people would continue this. There's another interesting study about this, that it's not just singularly people worried, like you said, about, oh, I'm going to get the second one's going to impact me more severely, and I don't want to deal with that. There's also urban versus rural issues. There's Democrats versus GOP issues. There's some racial differences in willingness to get the shots. So it's really going to take a multifaceted approach to try and get enough of these vaccines into individuals. Now, as we're seeing, big surplus in supply and a dropping demand for shots, which we really didn't want to see.
Yeah, so we need to match up that. We've got great supply. Let's get that supply used. And then in the case of the supply that is unused or maybe can't even be used, so AstraZeneca as an example, let's get that made available to as many people as possible. I think the science and the data is very clear on AstraZeneca. Yes, there is some increased risk, but disproportionate in terms of the effectiveness. It would be very clear if I was offered the AstraZeneca vaccine, which I can't because I live in the United States, I would absolutely take it. I consider it a safe vaccine based on the data and all of the work that's been done today.
Mm-hmm. Fascinating. And the other issue I think you wanted to discuss was variants. Is that right?
Yeah, so I think the thing about the variants is that we're just getting this front row seat to, full on evolution in real time, which is an incredible thing. So that's a testament to the just coordination, contribution of people. If you want to look at the variants, there's actually a really good website that's been put up in the UK that sort of tracks the variants in real time. There's a whole naming convention with these things that we haven't even established is problematic, variants of concern, the numbering, and of course, people have tied them to places and place names because it's easier to remember, but we really shouldn't do that. But here's the thing. Because we've allowed for this evolution to occur in real time, we're not seeing any more mutations in this virus. In fact, it's not at the high end of, highly mutating and producing all these variants. And by the way, lots of them just disappear because they don't do them any good. But the more you do that, the more opportunity there is for something positive to emerge. And that's essentially what's happening. So it's this unchecked spread of COVID-2 that is occurring in parts of the world. We're seeing this, terrible devastation is essentially allowing for this global emergence of, naturally selected variants that are better at transmitting and better at causing disease. Now, to be clear, the virus doesn't have a brain and it doesn't think about this. It's sort of, this evolutionary thought doesn't say, oh, right, I'm going to go develop this thing. It's sort of part of this random process. But evolutionary selection selects for those things because it sort of determines. But it's not necessarily the most lethal because, the perfect virus doesn't kill people. And in fact, would just sort of sit there and spread because it wants to survive. Because once it disappears, it's no longer in existence.
True, true. And that leads to an interesting article I read, which was in the Lancet, and sort of taking a look at this broader issue of, do you take an elimination strategy and hammer everything, or do you just seek to mitigate the disease? And the article is entitled SARS-CoV-2 Elimination, Not Mitigation, Creates the Best Outcomes for Health, the Economy, and Civil Liberties. And it was just published on April 28th by Miguel Oliubarton and a bunch of other folks. And essentially they looked at this issue of the trade-off between public health, economic growth, community solidarity, and civil liberties, and determined that those countries that chose to try to eliminate the virus and really hammer it and had good community support, etc., actually economically do better because they're able to get their economy regoing much sooner and not have to have this ongoing issue of trying to deal with this virus in different places and communities. So it'll be interesting to see as this data comes out more and more. But it also leads to the point you talked about. Those countries that have a mitigation strategy, like we're seeing with India, Brazil, or United States, are essentially putting others in the world at risk because of these variants you talk about and the opportunity for a lot of people to get infected and create variants. And so it also talks about the need for a global health strategy, which is something I think we really need to begin considering around this. And you've talked about it. You just mentioned getting these vaccines to other places.
Yeah, this is not a country problem. It's not a local problem. This is a worldwide problem. And I think you bring up a great point, Fred. As we sort of move past the nexus of this and, hopefully at some point emerge and, we've suppressed this virus, we need to have a better sort of coordinated strategy with all countries signing on. This is the protection. And I find that interesting. I mean, we can't go back and fix that at this point. It's too late for this one. But if you think this is the last, it ain't. We've had, at least two previous coronaviruses, or not pure coronavirus, but there are other coronaviruses, and we've had other potential pandemics which didn't impact us as much, fortunately. But I think we have to have a much better coordinated international response that everybody agrees to and share the load.
Absolutely. And with that, this is Fred Goldstein with Accountable Health. Thank you so much for listening. If you'd like more information or to reach out to us, you can go to accountablehealthllc.com.
And this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.